I'm going to cheat and use some notes. I just want to point out some of the highlights, things that have gone on, instituted last year during our first year of visualization and continued throughout this year. And it deals with various areas. There's research, policy, awareness, juvenile awareness, and programs. And I want to start with research because I think that's where I'm most proud of the work the region's been able to accomplish so far. We've contributed over $1.3 million in 2011 towards research, including completely funding the national initiative to find the biomarker for osteoarthritis. And by that I mean everybody knows their cholesterol number. Everybody knows their blood pressure. But what if you had a number that would indicate your likelihood of getting osteoarthritis and then have a treatment with drugs available to keep that likelihood down? So that initiative, and that amount of money is substantially higher than the collective states were able to give in prior years. Policy, and these are a little technical, but several different areas we've made significant inroads in, including the state of Delaware. And we testified and actually had the state lead to a study on specialty tier prescription drugs, and it's got to submit a report to the General Assembly. Now I'll let you ask Connie what that means. But I know it's a big deal. We've had 3 different state awareness days in the capitals of 3 states, and we're going to complete those by the end of complete the rest of our states by the end of the year. We testified before the Maryland Joint Committee on Health, Care, Delivery, and Financing on prior authorizations. I don't know if the rest of you go through this, but medical reimbursement and prior authorizations are different with every company around, and there's got to be a streamlined, simplified, computer-centric way of getting this stuff done, and we're leading that fight. Juvenile arthritis. This is where there's not a dry eye in the house when you talk about kids with arthritis. And we hosted a 3-day juvenile arthritis event in Washington, D.C. that helped over 1,000 kids and their families learn about the disease and learn about each other. And it was great to hear them and see them. I don't know who this guy is, but guy named, because this is under awareness, but NASCAR driver Todd Peck. He was there, he talked, met all the kids, they got to sign the top of the hood of his truck. It was a pretty impressive event. 22 families were sponsored by our region for this national event. We also started something called the Kids Room Network, and that's Kids, K-I-D-S, Room, R-H-E-U-M. And it's a network for providing information to kids on arthritis and to let them learn more about getting together. It's helped nearly 600 families in the region and hosts a monthly get-together. Programs, and by that I mean our aquatics programs, Tai Chi, Walk with Ease. We're currently second in the nation in the number of program participants, increasing our program leaders by 46%, and our participation level is up 18% so far this year. We've trained over 625 locations to deliver over 700 of our evidence-based programs for OA and RA to help thousands of people suffering with OA or RA. And we've got new programs, Tai Chi, which is going to be certified by the CDC as an evidence-based program in 2012. And Walk with Ease, a program at work where it encourages people to get together and walk during lunch or before work or after work. And I think it's marvelous for any organization to get involved with something like that. And Dick and I had fun picking on the head of Catholic Charities in Central Maryland, saying he needed that program desperately for himself. So we're trying to get them to work on that. Programs. We've collaborated again with Todd Peck, who has juvenile arthritis, the NASCAR driver. He attended the conference, and he's now racing his Kids Get Arthritis 2 truck in NASCAR Camping Truck Series. We've created regional agreements with Comcast, by our friend Mike Gordon here, and Time Warner, to sponsor or to create awareness for our Jingle Bell runs and arthritis walk events. And we completely updated and modernized our website, which really helped people find where they need to go when it gets to finding answers for arthritis. And I think that's just the highlights. It's been a lot of hard work, and I want to thank our CEO, Barb Newhouse, and our incredible executive staff, Terry, Connie, and Gail, and all the rest for all that work.
Thank you, John.